Hello, everyone, and thank you for joining today's webinar, Reimagining the Maternal Health Journey, a blueprint for integrating virtual, remote, and in-person care while aligning OBs, payers, and patients for better pregnancy outcomes. This webinar is sponsored by Wildflower and produced in partnership with Cigna and Women's Health Connecticut. Wildflower is reinventing how women connect to care by clinically integrating its digital solutions with the provider, the payer, and best-in-class partners. Wildflower delivers personalized experiences that empower women and their families, eliminating excess costs and reducing complications while nurturing loyal, long-term relationships between healthcare enterprises and the consumers they serve. I'm Sean Edwards from World Congress and Validation Institute, and I'll be introducing today's webinar. A few announcements before we start. I'd like to explain how we're handling questions. Due to the number of attendees, participant lines are muted. However, if you'd like to submit a question for our speakers, please do so using the Q&A feature at the bottom of your screen. We'll answer all questions that we have time to address during our session today. Finally, please feel free to contact our presenters if you have any additional questions. Please note the webinar will be recorded. You'll receive an email with a link to the video so that you can view it again. Now I'd like to introduce our speakers for today, Leah Sparks, Paula Greenberg, and Dr. Jeffrey Langston. Leah Sparks, CEO and founder of Wildflower Health, has more than 2 decades of experience building innovative healthcare businesses in both venture-backed companies and Fortune 50 corporations. Leah founded Wildflower Health in 2012 while starting a family of her own and seeing firsthand the gaps in healthcare for consumers. As COO, Clinical Operations and Ancillary Programs, Paula Greenberg is responsible for clinical programs, medical quality, performance improvement, risk management, clinical operability services, and clinical oversight for value-based payment programs. She has led performance improvement initiatives for patient satisfaction, leadership development, and office staff training programs. With over 20 years in healthcare management, Paula also successfully developed and supported revenue-generating programs and services, including imaging and in-office procedures. Dr. Jeffrey Langston is the Market Medical Executive for the state of Connecticut, joining Cigna on July 1st, 2019. Beginning in late 2017, he served as medical director for another large carrier in the New England regional care market, with responsibility for Connecticut. He has a diverse background in managed care, including ACO performance, value-based contracting, utilization review, network strategy, and sales support. Welcome, speakers. We're pleased to have you here. And now, without further ado, I'd like to turn things over to Leah Sparks to get us started.
Great. Thank you, Sean, and thank you, Paula and Dr. Langston, for joining us today. So I'm going to kick things off and then turn it over to Paula and Dr. Langston. But just to create a little bit of context before we dive in about Wildflower, we are a company that started 8 years ago and have been on a journey ever since to create a digital front end for women's health, to help women and their family better connect to healthcare, to connect to providers and payers, to improve the patient experience, provider efficiency, and ultimately quality and outcomes. We work today with about 24 health plans covering 50 million covered lives and health systems that cover 150 hospitals and hundreds of OB practices. We are really focused on measuring the impact of our solution and have seen savings up to $40,000 per high-risk pregnancy episode by leveraging a digital front end to more efficiently connect to care. Our focus is really on women who, of course, are the chief health officer of the home. And we hear a lot about how women make 80% of healthcare decisions for the family. I'd also note that the healthcare spend associated with women and children under 65, so in commercial and Medicaid, is over $900 billion. And there are many quality and outcome metrics that stand to be improved in women's health and children's health. And that's really the focus of the Wildflower platform and projects like this one that we're going to showcase today. We all know that one of the biggest challenges with the patient experience in the U.S. healthcare system is the number of healthcare silos that we must encounter. Due to the nature of our system, women in OB may be going to multiple providers. They may have care through their health plan as well as their provider. And layer on top of that, the hundreds of thousands of mobile health apps on the market can create a really frustrating healthcare experience, and one that really takes a toll on our ability to support access to care, support data continuity, and have a very good quality experience. And one of the things that Wildflower has long thought of, given that we work with both many health plans and providers, is how do we leverage technology to reduce some of the silos of healthcare, particularly our payer clients and provider partners. And part of the thesis behind the project that we're going to showcase today was using technology to put the patient at the center and enable the payer and the provider to align around her with workflow improvements and monitoring that really bring the two together and create a more seamless experience for the patient and better for the plan and the providers. So to that end, I'd love to introduce the project that we're going to do a little case study on today. The Nurture application and digital enabled OB care is a project that we have recently launched with our partners, Women's Health Connecticut, Cigna, Dorsata, which is a workflow and decision support tool for OB practices, along with Wildflower Health. And this project was really hatched many months ago before we were in this COVID crisis, and really began as something that Wildflower and Women's Health Connecticut were exploring to determine how could we leverage the Wildflower digital platform to not only improve the patient experience, make patient education more turnkey, but also to truly improve provider efficiency at their large, very sophisticated practice by using a digital front end connected into their workflows. And as the COVID crisis, of course, hit earlier this year, we began to expand the vision for this project to think about how can we enable remote prenatal visits in a very seamless way that is good for patients and good for providers. And that really led us to bring Cigna into the partnership, because to really support prenatal care, we obviously need the support of a payer and the appropriate financial support to pay for that type of care. And then as we brought in Cigna, we added another goal, which is really to reduce the silos of interaction that often happen between health plans and providers when a woman is pregnant, or in certainly other conditions. Our focus for today is obviously pregnancy. And that really led us to develop this project and launch the Nurture application and this care program, and that we'll go through with you today. Some of the key features you'll see as we showcase what we've done together with these partners are enabling workflows such as the OB intake surveys and other data that can be captured via patient digital application and then transmitted into provider workflow through a partner like Dorsata, which you'll learn more about. A personalized digital experience that is a front end for patients, but highly personalized to the mom based on her being a Cigna member, which practice she's a patient of within Women's Health Connecticut footprint. And last but not least, enablement of that really seamless remote care for Cigna members directly from the Nurture application that's a front end for Women's Health Connecticut. So those are the highlights, and I'm going to share a little bit more detail on that and then turn it over to our guests here. So the Nurture application that we've launched with these partners is, like many of the Wildflower applications, white labeled for the practice. So the brand Nurture, the purple icon you see there, was developed by Women's Health Connecticut's marketing team and is customized to their practice. And I would note that one of the things Wildflower's learned over the years is that by white labeling these types of applications, and having a woman associate the application with a healthcare brand, her provider or her health plan, or both in this case, really engenders more trust than a consumer brand that she may not know or be familiar with. And so within the Nurture application, I'm just going to do a little demo here. A woman is able to enroll and indicate her due date, maybe add some other family members like a child or a husband. And then her experience in the application is a really personalized feed on the mobile device that changes week to week, day to day, based on her gestational age, based on what might be going on with her children, what reminders she might have for to-dos. And within the content, she can dig into content and even link out to resources and actions associated with her particular practice within the Women's Health Connecticut footprint. In addition to this content and education tailored to her, she can also do certain types of workflow, such as the OB intake survey form that is often the first step, or is most always the first step in a prenatal experience. And she can submit that right in our application, and we can transmit it through Dorsata, our partner, right into the practice's workflow. Additionally, we can take blood pressure and other trackers, which I'll share more about, and send that right into the workflow. So that's an overview of some of the highlights of the features, and some additional features I will highlight that I couldn't share as well in the demo are a few other things that make this really important for workflow and for supporting the practice and the plan and the patients. So the workflow in the application is triggered by scheduled appointments. So thanks to, again, our partnership with the practice and Dorsata, we are able to read in our application when appointments are coming up, whether they are virtual visits for Cigna members or some other type of appointment, and then trigger to-dos and actions and intake forms based on those appointments that we can read in the schedule. That then prompts us to do things like take the survey that otherwise might be done in the practice while you're waiting for your appointment, or in other formats. We can do it in advance of the appointment on our device and send it right into the workflow. And the screenshot you see on the right is from Dorsata, the practice's workflow and clinical decision support software, who has connected with Wildflower via an API, enabled us to take data from the patient and transmit it real time into the practice workflow. And then Dorsata can do things like run rules against things that have been submitted into the app. So in this example, if a mom put in, yes, I've had lead exposure concerns, Dorsata can highlight for the physician and or the midwife, the provider, and help them be really efficient when they have their first encounter with that mom. Similarly, for Cigna members, we are enabling ordering of Bluetooth devices as well as a remote fetal Doppler. The devices include a Bluetooth blood pressure cuff, a Bluetooth scale, and again, the fetal Doppler that is meant to be used during a video visit with a provider. And with those Bluetooth devices, we are able, similar to the intake surveys, able to take that directly into a mobile application, help mom track her weight and blood pressure over time, give her some visual cues, in this case with weight, give her alerts on the device if a reading is out of range, particularly with blood pressure, and again, submit those directly into the practice's workflow via Dorsata, where again, prior to a virtual visit, a provider can check in with the mom's blood pressure reading, check in with her weight, and make that visit as efficient as possible. Beyond that, the application is tailored to each practice within the 40+ practice footprint clinic sites that Women's Health Connecticut has in their geography, so that based on a mom's individual practice patient ID, when she registers, we can pair her with a unique practice location and have custom content, phone numbers, virtual visit links for that particular practice site. And for Cigna members, we are able to take eligibility right in the practice's application and connect those moms to Cigna benefits during their pregnancy, whether it's the 24/7 hotline, how to get your breast pump benefit, all of the things that Cigna brings to bear for its members can be connected right in the application. So as opposed to a pregnant mother needing to navigate to her health plan and provider separately, she can bring it all together in one digital experience. So, our goal for this project was to look at the silos that we have in healthcare today, look at some of the gaps in workflow, and really reimagine the patient journey in this initial project. Everything from how women are onboarding into our application through an alert in the Women's Health Connecticut systems that a new OB appointment has been scheduled, and that triggers outreach to invite the mother to onboard into the application. The ability for women to submit key data such as their new OB intake form, submit things like the blood pressure readings and weight readings, and transmit those directly into the provider workflow, helps to hook the patient experience into the provider workflow with a best-in-class personalized digital front end. And this enables not only good self-management for pregnant women so that they're staying on track with education, staying on track with preventive checklists, but it also enables an ongoing touch point in between OB visits, either through monitoring devices or through organic engagement with the digital application, so that if an issue arises in between visits, mom can be escalated either to her provider at Women's Health Connecticut and or care resources available through Cigna, such as care managers. And by doing this, we're not only improving the patient experience and provider efficiency, but beginning to collapse some of the historic silos of healthcare. So that's the introduction to the project and what we've been up to. And now I would love to turn it over to Paula Greenberg from Women's Health Connecticut.
Hi, good afternoon. Leah, you could go ahead to the next slide. So who is Women's Health Connecticut? We are a large Connecticut physician group of about 168,000 patients, about 200+ providers in the state. We're a national company. We are wholly owned by Women's Health USA, which has about 600 providers nationally, soon to be a little bit more than that. We are growing in Texas, Arizona, and Nevada. Specifically for this pilot, we launched in Connecticut only, and we can go on to the next slide. Our brand is really to give unrivaled care to women. We're very, very focused on women's health. We want to use our quality, our experience, our scale to differentiate an experience that our patients would have compared to a small private practice. We want to make healthcare accessible to our patients. We want to give it to them where they need it, where they want to see it. We want to spotlight the patient experience. Our tagline is devoted women committed to excellence. And we really want to show that kind of unrivaled, what we would call devoted and commitment to excellence, and really listen to our patients about what they're experiencing and how we could continuously improve what we provide to our patients. And then again, to build programs that connect with our patients in a consistent and singularly way across our network is really, really kind of the brand image or brand platform that we survive on. We do a lot of surveying of our patients. We do patient experience through Press-Ganey and other devices, but we also do a lot of direct-to-consumer surveying. Our patients tend to be vocal, they tend to respond quickly, and they tend to be very, very clear about what they see our practices providing and where they want our practices to head. So our mindsets, you can advance, Leah. And the COVID impact, this was something that came from the American College of Emergency Medicine, our emergency physicians, but it really mirrors what we are seeing from our patients during the peak of COVID and how we reopened. We're located in Connecticut. So we've been a ground zero location for many, many months, and we've seen the COVID impact. But patients are likely to have, COVID is likely to have a permanent impact on patient behavior, their choices, how they get care, how they want care delivery, and their willingness to come to an office for care. They're very, very fearful about contracting COVID at healthcare facilities. I think we've really done a great job as a healthcare provider group to ensure that it's a safe experience. We proudly communicate the safety of our offices to our patients. We want them to come back. We believe obstetric care and problem gynecology care is essential care, and we want that message to come forward clearly. 30% of our patients had employment changes and are worried about using time off for healthcare appointments. We want to make sure that when we're coming to the office and having our patients come to the office, that we're as efficient as possible and using tools to supplement their care when they're in their home or working from home is the key to us. 45% of patients have skipped an annual visit, and we're very, very concerned as OBGYN providers that we have the risk of missing cervical cancers or breast cancer. So we're really, really concerned about getting our patients back to seek care with appropriate providers. And we know that 20% of our patients had a telehealth visit during peak COVID, and we know how highly satisfied they are. We were able to turn up universal telehealth platform in under 3 days once we had the governor's orders to kind of put everybody in what we would call a quarantine 2-week period, which extended beyond. We see telehealth as a supplement to OBGYN services. We don't see it as being something large that will replace what we believe is the essential office-based care. So, we're evolving with the market. We have been in one mode of what I would call OBGYN care delivery, which is in-office care. We know that home-based care is a space that we have to emerge with new programs, hence Wildflower and our Nurture app co-pilot. We know that we have to have tools that enable the patient to have care, appropriate care in the home setting, and be able to deliver that in a way that we know meets our needs as providers, making sure that we have the information we need to deliver safe care to our patients. And we're in an area where value-based care is going to be a priority, and this is important not just for the payers and for the providers, but for the patients. We want to make sure that patients believe they're getting a value for the care that we're providing. So onto tools for success. From a value-based perspective, we see ourselves as a specialty medical home. There's no other, what I would say, episode than the OB episode that lasts really a 9-month, as a pregnancy. We have a shared savings program with Cigna and others, and it's really, really critical for us to look at ways that we're delivering that care and making sure it's efficient and value-based. Leah talks about the silos, and we're really trying to kind of break those down and enhance the care that we're doing. Patients are demanding enhanced access. That could be from online scheduling, digital check-in tools. The Dorsata OB EMR also helps with the access that we're providing to our patients. And home-based care, we have the Nurture app, but we also are entering into live online childbirth ed, lactation support, telebehavioral health, as well as our own virtual visits. You know, again, it's how do we wrap around services that are traditionally not necessarily part of an OBGYN's major source of care, but again, these are services that our patients seek and have, and how can we build a program around them for efficiency. And then in-office care, you know, we have to think about other ways of in-office care that we're delivering care to our patients. So we're scaling up care management. We're opening up more extended care services to our patients as opposed to urgent care. And we believe that we have ways to reduce some of the inefficiencies by kind of doing consolidated extended care services in our small state. By offering patients an opportunity to come to care late evenings and 12 hours a day on the weekends. And ancillary services, again, making sure at that annual visit, if we're able to do a mammography or doing certain lab testing to ensure that they're getting the tests that they need at our offices, as opposed to having them leave our office and go to another setting for these tests, we see that the compliance rates are higher when we add in-office services to our patients. So the current model of OB, and this is kind of interesting, we have the luxury of having Cigna literally in our backyard and have had in-person meetings with them as well as Zoom meetings. We've had conversations about how can we best partner with each other, and late winter we had a conversation about what is it about our patient population that we have in common, and what do our patients see or providers see as obstacles to having care coordination. One of the things we know is on average OB patients download 3 obstetric apps. And one of the things that providers have a concern about is we have no control over the quality of the patient content, the services that they're offering, and we know that these apps tend to be static, so that there's information the patient may be putting into the app that they may not share with the provider, or they may not think about bringing to the provider as a question. And we really thought, how could we control that? What's the best way to use it, leverage an obstetric app where we could control some of the content so that we know it mirrors ACOG guidelines, the Society for Maternal Fetal Medicine guidelines, and helps deliver key messages at the right time for our patients. And some examples that we looked at were, how do we reduce risk? We looked at our claims data and said in our perfect world, there would be key messaging in high-risk patients that we would send key messages through this app to the patient to help them know what's important about their care. What are the safe meds in pregnancy that they should be using and not using? And then the appropriateness of prenatal testing and vaccines. And we had this conversation with Cigna. We said, we're unaware of what services Cigna provides to the patients. We have multiple payers, and it's very difficult on the provider side to know what's covered, what special services there are. And we know that our patients are often unaware about these services as well. And one of the other things that we heard from Cigna is sometimes we don't know that the patient's even pregnant until we get a hospital admit bill to process. So we know that there's kind of those silos and that gap, and how can we leverage an app to help bridge those gaps? And that's really the sweet spot of using the Nurture app and Wildflower behind us, is really kind of closing those gaps and helping us manage these patients and giving them the tools that they need to help know that there's services available for them, and that we as providers are supporting the payer and not looking at it kind of as the people that just pay our bills too. So it's really, really important for us to kind of partner with the payer on this aspect. We have episodes of care and with Cigna, and we noticed that our ED and labor and delivery use is a key driver on the expense side. And we believe that proper communication using an app and continuous reinforcement is really, really the key for our healthy, low-risk patients, and especially in our high-risk patients. There's a lot of lack of reinforcement between visits. We know that patients shut down auditorially when they hear that they have a high-risk condition. Sometimes it's too much to process in one visit. And so we really believe that adding the tools within Wildflower and the messaging from Wildflower, so the scale, the blood pressure, cough, and linking that to the patient will really help them take the necessary steps to maintain a healthy pregnancy. And we know that COVID impacted our obstetric care. ACOG and the society found, looked at the number of visits that a normal OB had and said, instead of the 10 to 12 visits you have, we should reduce them by 2. And how do we get those 2 other visits? They're still essential, but how do we virtualize those visits? So we started to do that. And then we thought, how do we also, with the high-risk pregnancies, make sure that we're having the additional visits that they have to keep our moms safe. And so the virtualizing and the devices that we're using have really enabled us to create a more virtual experience for our patients. And we believe that they will feel more connected when they have a virtual visit, knowing that the data is feeding over to their medical record, knowing that we have flags in the medical record if there are changes that we need to review in between those visits, and that we can manage a healthy pregnancy for our at-risk patients. And what are our goals with this? I think that's really at the end of the day, how do we know that this pilot is a success? We know that this is an opportunity for us to improve outcomes for our patients. We can look at how many preterm deliveries, how many patients we delivered at term. That's really, really the key for us. How do we supplement the essential visits, and what did those look like, and what's our patient satisfaction related to those virtual visits? How do we sync the payer, the patient, and the provider with a care plan, and working with Cigna when we identify high-risk patients, we're automatically sending them a communication that says we have a high-risk patient. They're getting these devices, and really early intervention with their care managers is critical. And we see that as a critical component to success with this, because prior to this pilot, I can say that doesn't happen, because it's today at Cigna, how do we get that? Who is that point of contact? We've really aimed to kind of improve that workflow with the payer. And, really to kind of promote the efficiency, reducing the unnecessary ED and labor visits, and then win on the value-based care. If our outcomes improve, if our costs go down, we're winning on the episodes of care and the bundles that we have. Okay. I'll turn it over to Dr. Jeff Langston.
Yeah, thanks so much, Paula, and great presentations thus far, really highlighting the value of strong collaboration and strong communication, really. So let me just begin with Cigna. Is more than a health insurance company. We're a partner in total health and wellness, focused on caring for the body and the mind. Our mission is to improve the health, well-being, and peace of mind of those we serve by making healthcare affordable, predictable, and simple. Next slide, please, Leah. So when we talk about affordability, that really means lowering the total cost of care across all stakeholders. Predictability is about removing surprises and helping people make more informed healthcare choices. And simple is making it easier for the people we serve to get the care that they need. Our company has over 70,000 employees who are all dedicated to living our mission and being champions for our customers and communities. And with more than 180 million customer and patient relationships in more than 30 countries and jurisdictions, we're able to harness actionable insights that address whole person health and drive better health outcomes. The 3 themes of affordable, predictable, and simple are behind everything we do as a company. And we're the driving forces as to why we wanted to be part of this new maternity program right here in Connecticut with Women's Health Connecticut and Wildflower. Slide 3, please. Now, in line with the theme of affordability, thanks to our previously established Healthy Pregnancies, Healthy Babies program at Cigna, We understand that when we're able to keep mom and baby healthy and reduce things like emergency room visits, hospitalizations, and NICU admissions, we can keep down the overall cost of care. This program increases predictability because there's a single patient experience. All of our Cigna content will be pulled through within the practice's application, enabling patients to access all the information that they need in one place, taking a lot of the guesswork out of the equation. Lastly, the program truly makes maternity care simple and more convenient for our customers. We're hopeful that more frequent monitoring through our virtual program will decrease complications of high-risk pregnancies. Back when we first discussed developing a program, there were a couple of key factors at play. As we all know, and as folks have mentioned on this panel, the global pandemic has had many impacts on our lives and has made it more challenging to engage with patients in a traditional setting due to concerns about the virus. We also wanted to test our hypotheses and see if additional monitoring and engagement with high-risk pregnancies would result in better health outcomes. When I mention high-risk pregnancies, there are typically a number of factors that make them high risk. These can include things like high blood pressure, diabetes, depression, abnormalities in the placenta or fetus, previous preterm delivery, or multiple gestation like twins or triplets. With this virtual solution, Cigna and our partners adapted with the times and are sitting on the cutting edge that allows us to better engage with patients in the age of COVID in a more simple way. I'm really thrilled about the way this partnership is set up and believe it could be a model for success. When you take an incredible technology company like Wildflower, a top-notch health provider in Women's Health Connecticut, and a company like Cigna, who's focused on improving outcomes through engagement, data, and analytics, innovation is the result. As we look forward, and as is the case with any new program, people are generally resistant to change. We could certainly experience some inertia, and we have a responsibility to help people understand that this is a positive change where their engagement could result in better health outcomes. Focusing on those three pillars of simplicity, predictability, and affordability can help us break through. And once we have statistics and proof after we run through this program for a bit, that will hopefully make for easier convincing and scaling. There are really two objectives from Cigna's point of view when it comes to how we're going to define success. Number one is to increase engagement in our care management program, especially for those high-risk pregnancies. We've proven that care management programs like Healthy Babies, Healthy Pregnancies work, but to really harness the value of the program, we need to get more customers to engage. With the simplicity and ease of use this new program represents, we hope to increase the number of individuals able to fully capitalize on all that Cigna can offer. We firmly believe that increased engagement and monitoring will result in better outcomes across the board. The second bucket that we will use to define success is through clinical endpoints. And again, Paula did mention several of these, but we look to things like reducing emergency room visits, reducing hospitalizations, and reducing NICU admissions. We realize that healthier moms, healthier babies, a lower cost of care, and improved peace of mind, it's really a terrific set of outcomes, and we hope this program is certainly going to help us get there. So with that, we pass it back to Sean.
Great, thank you, everyone. And a couple of questions just to start us off here. So for Paula, how do you quantify the benefits to digitally enabling certain workflows in your practice?
I think, the thing we noticed is when we reopened post-COVID specifically, the amount of time it takes to prep rooms and enable us to deliver care as quickly as possible. So for those of you that aren't in the medical office setting, we really have had to reduce the number of patients in the exam rooms, not in the exam room, in the check-in area, as they travel into the exam rooms and out the door. So using apps like Nurture, when you have a first-time pregnant mom, this is a good hour-long visit. And a lot of times what we'll see is the patient is rushed because she doesn't expect it to be at least an hour, even though we've told her it. And the doctor may be rushed because he's trying to move through new and additional patients. So this allows that mom to complete a full health history and have it answered in a thoughtful way. And then when the doctor comes in or the provider comes in to visit with this patient, he's seeing her complete answers in our EMR and then can really hone in on what the risk areas are, as opposed to getting questions answered and clicking in an EMR. So it really creates what I would call provider efficiency, because now they can have better conversations, targeted conversations about, do you need genetic testing? Do we need to have a consultation about the medications that you're using as part of the medication management for another health condition? Do you need a referral to a high-risk MFM provider based on your health history? So that allows those conversations to really be the focus of the visit, as opposed to data gathering. And then it allows the office staff some efficiency, like I said, because this is being complete as part of the digital check-in. So the patients are digitally checking in, they're completing this application, they know where their appointments are, and it really kind of reduces what I would say the calls between and the touch points between visits of, I forgot what date my appointment is. It's all readily accessible in this app.
Got it. And a question for you and the rest of the panel. How do you target or determine high risk in the participants, and how do you handle outreach and onboarding? You touched on it a little bit, but some more insight would be helpful.
So we literally sat down with Cigna and said, here's what we think high-risk pregnancies are based on what ACOG would call them. We looked at what our experience was in our episode data, and we really kind of had a very collegial conversation about what we saw as high risk. And some things we saw as high risk that they might not have otherwise identified. A perfect example was IVF care. So a patient may have the IVF rider in their care, and that episode kind of ends because they've achieved a successful pregnancy, but there's a lot of risk exposure with IVF patients. So not your typical medical diagnosis that you would think of as high risk, but we definitely know that those patients require a little bit more surveillance.
Got it. And could the mother interact with the case manager through the app?
No.
Yeah, this is Lee. I'm happy to take that. There's not direct digital interaction. What we're able to do is expose the Cigna program and then connect that mom via telephone or through referrals at the member level to Cigna for care manager outreach to that mom.
Got it. And when you think about mental health and wellness, how are you approaching those issues in the app?
This is Leah. I'll start, and Paula would love your perspective on this. So we include, ever since we started the company 8 years ago, we've always included content on not just postpartum depression, but mood and anxiety and stress throughout prenatal period, and quite frankly, as we've extended women's health, that continues, and is certainly we've had plenty more articles to add on that topic with the COVID crisis. So we have a lot of content, and then prompts to connect to care if the content is leading you towards an issue. And then we also mobile enable the postpartum depression screening tool in our application, which based on that screening either connects you digitally to care based on how you score, or prompts the mom to take an action depending on what the client prefers. So we, from a digital perspective, have a number of content and screening tools to support providers. And Paul, I don't know if there's anything you would add to that from your perspective.
So we also kind of wrap around the Nurture app with our digital check-in. And our digital check-in, our standard is that we screen all women 4 trimesters, we would call it. So prenatally and even postpartally for depression. And for those patients, we can triage them 2 ways. We can refer them to providers if they have a provider that they know for behavioral health, or we have access to a telebehavioral health program that we are referring them to. The program that we use is actually part of a care coordination model. And so the providers, the social workers and psychologists who are providing the service literally are able to create a care plan and communication into our EMR so that we can see the progress of that referral and coordinate the care and ensure that the mom is getting the care that they need.
Great. And question for Dr. Langsam. So for Cigna, do you think, for clinical endpoints for evaluating the program, are you also focused on preterm births or incidence of severities of PMADs and C-sections? We'd love to learn more about that and where these outcomes fall.
Yeah, so that's a great question. And the short answer to it is yes. You know, the endpoints that we saw on the slides here and that we spoke about are some that we started with, and they're sort of easy to measure and to analyze from a carrier's perspective, and they're very tangible when you look at things that contribute to costs in an episode of care or a bundled program. We have many other, let's call them softer metrics that we're not necessarily hedging one way or the other or on what we would expect, but but we certainly are going to pay attention to them and measure them, and we certainly think they would have value. We mentioned C-sections, that's certainly a big one. Preterm births is a big one, and even just some learnings about how patients are going to use some of these new virtual capabilities in this age of COVID, and the chance to harness some of this technology.
Great. And as a follow-up, Dr. Langsam, does Cigna Case Management have management protocols for high-risk conditions, or is this something that needs to be developed?
So another great question. So yes, we do. There are protocols for all types of high-risk conditions within the care management program. The issues that we've seen, and they've been called out here well by my colleagues, are that while we know those protocols are effective and the program works, the challenge lies in getting people to actually take advantage of the program in the first place. And it really highlights the value of this collaboration, because it might make it a bit easier for us to identify if someone is pregnant and identify a risk stratification before, let's say, somebody actually winds up in the hospital. So we've got the framework in place, and this type of program is going to help us drive that engagement.
Got it. Thank you. Paul, I'd like to jump back to you for a quick second. Could you talk about, are you currently providing online childbirth classes, or if so, are they live, are they interactive? How's that been going?
So we did a survey. This was literally a month and a half ago with our patients to try to understand what services they have, what they have used. So we did a survey of we practice at 19 hospitals, 20 in Connecticut. We did a landscape of who's providing what to their patients. And then we surveyed 1,000 patients who had either are in their last trimester of pregnancy or who had a child. And we asked them, is this the way, if you had to do this again, would you use this model, or would you like a live online model? And 700 patients responded within the first 3 days of the survey going out. So it's very, very clear to us that they want live online classes, and we are working to kind of privatize a model using some of our childbirth educators to create that model for them, likely to launch Q1 2021. But again, kind of, our goal is, how do we control messaging? How do we develop the right, some of the things that we want patients to be aware of in that in that period, support, reducing ED admissions, false labor, making sure that patients know to call us first. So those are really, really critical things that we want to make sure that we can standardize across the enterprise.
Got it. Question for you, Leah. What about patients who have prenatal loss? Does the Nurture app stop sending gestational development reminders? That's been an issue in some generic market OB apps, which can compound the emotional aspect of the loss.
Yeah, that's a great question. We do have a feature where if a mom can report a fetal loss, and of course we immediately silence the application, and also surface content to be supportive to her during that time period. And in some cases with some of our clients, we even do EHR reads to read when there's been a fetal demise so that we can be really proactive about that and sensitive to that. So definitely a really good question.
Yeah, and we're on our side too. We're, also making sure that any patient who experiences that we would, work with Wildflower to disable the app.
Got it. And I'd like to jump back to Dr. Langston for a second. Do you think remote prenatal care is going to eventually be standardized as part of the reimbursement for prenatal care, and how will that move to bundles impact it or not?
Yeah, so that's a great crystal ball type question, I guess. So the current state is that those services are not separately reimbursable, right? Pregnancy is paid under one case rate, and any type of service that falls within that today is included in that single payment. We do see a lot of value when we start to think through our progression from a fee-for-service to a fee-for-value world, and things like bundles and episodes of care gain more and more traction and uptake. That's where I think, really see the future benefit. Is anything that can be done that can drive down the cost of care while simultaneously promoting improving quality and outcomes. I think that's where the money is.
Got it. And another question coming in from the audience: does it matter what EMR you use?
So the Wildflower app, I think, Leah, you can speak to that.
I had a little trouble hearing that question, Sean. Cut out on my Wi-Fi right when you asked the question.
My apologies. The question is from the audience: does it matter what EMR you use?
So from the Wildflower perspective, we are agnostic to which EMR a client is using. We have integration partners. Dorsad is one example of them that Women's Health Connecticut is working with. We have other integration partners where we can be really agnostic to whatever EMR a practice or health system is using.
Got it. Okay.
And I would also say, we can also work with clients who don't want to integrate with their EMR. I mean, Paula in Women's Health Connecticut is a huge practice, but we have some practices that are smaller or, don't have a very robust EMR footprint, and we can provide data from our application through a web portal if they want, right? That we can link into their workflow to show survey data and blood pressure readings. So there's lots of options. And I think when you're a technology provider, you have to be extremely flexible to meet the demands of different technology footprints of different providers and different workflows. If this does not fit into workflow and isn't designed for workflow, it's never gonna get the type of patient adoption and physician and provider support that you need. So it's something that we are very sensitive to and try to be as flexible on as we can.
Got it. A question for all of you: how are you going to measure the project outcomes, and what will you do if this is successful in your respective organizations?
I can start. We have, as I said, we have episode of care with Cigna. So these patients will be in that episode, and we get, data points on I think a quarterly basis, and then a roll up of an annual. So we should be able to figure out the cutoff of our starting of the pilot and follow these moms in their outcomes through there, and look at the total spend, number one, to see, did we win? Did we make any difference? And then using our medical records, we can also look at outcomes. So this, I think, is a kind of a unique situation. We've historically looked at the financial performance of the episode with Cigna. Now we're going to really start to say, okay, here's the financial performance, and then what was that actual outcome of that pregnancy? And then what was the patient experience related to using this app? So we've got 3 different pieces that we now can look at and kind of talk to, how the outcomes are. So obviously, did we win on the case rate? Yes or no? What was the outcome? Was there a reduction in those NICU days? Yes or no? And then really about that, how many patients were in that total data set? What was their overall outcome? And then patient sat wise, what was their satisfaction related to the experience and the care coordination if they were deemed high risk? Did they feel that everybody worked together, or did they still feel like it was choppy or siloed?
Mhm. Yeah, and I'm happy to chime in. I think, Paula's right. The ultimate indicator is, did this move the needle on cost, quality, outcomes? That's always what we're focused on at Wildflower as the endpoint. And I think what we look at is, what are the leading indicators that would tell us we're helping to get there? And as Dr. Langsam said, it can be very difficult for our health plan partners to identify pregnant women early, and much less identify high-risk women early to deploy their intervention. So we're going to be looking at, especially with the way Paul and her team are integrating this into the new OB workflow. So you make your first prenatal appointment, you are being triggered to do before your first visit or before the visit with the new OB intake, download the app and get into the workflows. And we, our leading indicators will be, okay, did we engage more women in the first trimester, more Cigna members in the first trimester? Did the virtual monitoring help us to both the practice and Cigna more quickly identify high risk and get that right personalized care model coordinated between the plan and the provider in place faster? And those, we believe, will be the leading indicators that will help us look longer term at the moving the needle on quality and cost.
Yeah, and I guess, I would layer on top of that. So, measuring success, we talked about engagement in the program from a Cigna care management perspective. That's certainly a big one. And then, we mentioned a lot of those clinical endpoints that folks have reiterated, and then it really plays to the quality and the affordability elements. Certainly, it's a win-win for everyone if we can actually achieve those. I think, asking the question about what would happen within the organization if this is successful, this is a very exciting time. Virtual care has been around now for several years, but uptake has been sparse. And with the pandemic, we've been forced to accelerate our learning and to think outside the box a little bit and try some new things. And so there's a lot of excitement on seeing where these learnings take us. And maternity itself is a particularly challenging area of medicine to impact from an affordability perspective, because a great majority of the costs, let's say, are driven by facility choice, and there's limited opportunity to impact that. But this gives us an inroads into it, and if we find that some of these other levers are successfully pulled, could this be the type of project that gets wider uptake across the enterprise? I mean, certainly that's a possibility.
Yeah, and I think that's a great point. Sorry, just to add on, Dr. Langsam answered the second part of that question, and I didn't. I think if we can demonstrate through the partnership with Cigna and Women's Health Connecticut that this model of using providers as the primary activation point for patients is the best way to support her, as opposed to having different types of experiences where we're asking her to go direct to the health plan. I think we'll always want to have our inroad where those women need to go direct to the health plan. But if we can prove that this model is more successful, we certainly hope that it can be something we replicate with our health plan partners and really look at a model that can support their network providers much more scalably at engaging women and routing them to their right care.
Great. That actually is a question for Dr. Langsam, but certainly Leah and Paula, feel free to chime in. Langsam, can you talk about the communication, coordination of care between Cigna, patient, and provider? For example, if Cigna case management coordinates additional services or enrollment in programs, is the provider notified?
Yeah, that's a great question. So this entire program is really built on communication, right? And it's a bi-directional flow of information. And without that, it would be challenging to succeed. We all recognize that the providers are the linchpin of this being successful, right? They're the ones that are providing the care, obviously, and they're the ones that are really going to drive most of what happens. So certainly from a Cigna perspective, if we enroll an individual in a certain program or we get some information from them that would be relevant and necessary to share, then by all means that will flow right over. And likewise, if something relevant is happening within the office setting that Cigna should be aware of, then that information will come to us as well.
Right. Leah, we have a question for you. Is post-delivery lactation support information incorporated into the app?
Yeah, so in a couple of ways, we certainly have content to support breastfeeding and feeding in general, all types of feeding. And we have feeding trackers that are heavily used. What's really interesting about our statistics is, you know, when we started the company, I had the bias that pregnant women would be the most engaged users, and that's not true. The most engaged users are women with newborns. The average sessions per month can go up 2x when a woman has a baby, and it's a really interesting time because she's not seeing her provider as much, and she might feel even sort of less alone, and it's a vulnerable period. But we see the use of these trackers, the articles on newborn care really spike the use of the application. So we have a lot of articles about feeding, and in all of our applications, we have the ability to connect to our clients' resources. So virtually all of our provider clients and many of our health plan clients have resources to help connect women with lactation support, so that it's not just digital only. There's a way to connect out in a personalized way to the resources with the practice or with the health plan.
Got it. And a follow-up to that, and certainly would love to hear from Paula and Dr. Langston as well. When are individuals typically onboarded?
So the way our office works is we have two appointment types, and so it's triggered based on our EMR appointment types. Confirmation of pregnancy. After confirmation of pregnancy is done, either mom does a urine dip and has a positive, or she comes in and we confirm her pregnancy. Before that first prenatal visit, or we call it the initial prenatal visit, happens, they're getting a push email. So our staff say to the patient, I'm booking this appointment. We're going to send you a couple of communications about this great new app that we want you to do before you come to the office. You'll find that it's got so many great tools for you. And then we push the app communication out so that they can just download it from their phone. And then we follow up. I believe, Leah, there's certain days, like certain number of days, where they get a second push communication that says, hey, you haven't downloaded the app, remind, and even after that visit. So we're trying to use as much kind of push communication to kind of get them to engage with the app. And then at either the confirmation visit or at the next visit, the doctors and the staff are saying, hey, have you downloaded this app? Because I think it's important for you to kind of use the app. So, it's a push and a pull. We have a lot of what I would say marketing materials in the office highlighting this. We have weekly meetings with the teams to kind of talk about, how are you doing? How are you engaging? What are the, what else can we do to kind of support engagement? This is new, so we're starting to see good turn on, patients buying this app to their phone. But, again, and we have to really kind of look at how, what is that trigger that's going to get that patient motivated.
Yep, and I would just add that, we've learned in 8 years of driving technology adoption that there's no single silver bullet. I think, having digital outreach that's timed, especially to a first prenatal visit, having reinforcement by providers, having multiple ways you're communicating to women is really key to getting maximum adoption. And we know that the personal referral by a provider is incredibly powerful and makes women feel like they're going to be using an application that they can really trust because it's an extension of their provider practice or their care provider through the health plan, or both in this case. So that really makes a difference as well.
And I think our doctors can support this app because they've helped build some of the key messaging. So it was really important for them for key messaging. We spent a lot of time working with Leah's team on certain messages, what we wanted to say during certain periods during the pregnancy touch points. So I think that really makes them feel like it's their private labeled app.
Got it. And we're right up at 3, but I'd like to squeeze in 2 more questions quickly if we can. Dr. Langston, can only Cigna members use the WHCT Nurture app?
So the answer is no, but let me actually pass that to Paula for clarification.
So we're starting with just Cigna patients. We wanted to give them a running start just because we felt that, you know, the technology partnership and helping us and, you know, supporting us through providing the high risk devices was really, really important. So we've given them a running start. We haven't downloaded or encouraged downloading of others. We want to make sure everything in the pilot works as designed. So it's a great sized patient population in Cigna. So right now that's where we're focused. We really want to see if we can move the needle and be successful first with them.
Got it. And one question just to close this out. I'd love to hear from all 3 of you. What are your priorities in terms of delivering first trimester content, given that trimester is important in terms of early interventions?
So I think I heard, what are your priorities? You know, our priorities again are to understand, you know, help patients understand the choices or the decision points that they have to make in that first trimester. Safe medications, perfect example, genetic testing, you know, what's their risk factor, occupational exposure, understanding those conversations, and really kind of creating an opportunity for, you know, a lot of times this is the first real, other than an annual visit, this is the first real relationship that patients build with a provider, and, you know, the building trust in those relationships and knowing that you can talk to an OBGYN about anything that concerns you during your pregnancy is really, really, I think, mission critical, and knowing when to call us. It's the only specialty that truly is on call 24/7, other than like hospital brick and mortar providers that really, you know, take the time and answer calls in the middle of the night when women are scared and concerned about their pregnancy. So I think for us, this is really kind of that extension of our office-based care.
Got it. Do you want to close this out with some thoughts and priorities in terms of first trimester content, given the trimester's importance?
Yeah, I mean, I think for us, so much of what happens in the pregnancy can be detected by what you learn in the first trimester, especially a mom's health history or prior pregnancy history. So we really prioritize doing like we're doing in this project, hooking into workflows to help both our plan and provider partners get a good picture of the health history so that we can personalize the content based on the sort of health profile of that mom right from the start and make sure she's supported in a really personalized way.
Great. All right. We are out of time. I want to thank all of you for joining us online today. Thank you so much to our speakers, Paula, Leah, Dr. Langston. Thank you to Wildflower for sponsoring today and making this session possible. Just a reminder, today's webinar has been recorded. You'll receive an email with a link to the video so that you can view it again. To access any additional webinars or get info on how your organization can speak or sponsor, please visit wcwebed.com. Thanks again for joining us today. Have a great day. And this now concludes our discussion.